patient who had COPD, which is a lung problem. He had lots of admissions in the hospital, lots of long stay in the hospital. So what I did was I picked up the phone, spoke with him. I said, come in and let's have a little chat about what's going on. He said, look, I've got this problem. I don't really know what it is, what's happening when I become unwell, and what I need to do. So those are some of the things we had a discussion and dialogue about. And we discussed some of the things that he could do when he could become unwell, and when really to contact us and to seek help. And overall, what we found is it reduces the amount of times he goes into hospitals, and in fact it's developed a better relationship between ourselves. And for the first time in many years, he's actually been able to go away on a holiday. So it's made a massive impact on his quality of life.
The clinician skills training is so important because the healthcare professional needs the skills to be able to work in partnership with their patients. We need to be able to make the most effective use of the time that healthcare professionals have with their patients. The course is designed to make sure that participants really get a chance to practice some of these skills that we're talking about, because they need to feel confident that when they go and try them with patients, they know how to handle them.
The skills for self-management, I think all of us as healthcare professionals, we all have them. It's just really how we use those skills in the consultation.
So previously, traditionally, the goals were set by the clinician and the patients were measured against achieving those goals. We've turned that on its head. We've said that the goal needs to be owned by the patient.
Talk me through a little bit the things you've been doing to keep well.
Did I allow the patient to say their piece? Did I talk too much? Did I explain certain things too much? Did I really understand what their goals and their actions were? Did I check how important it was to them? And did I check how confident they are to manage it? Overall, these skills would lead to effective self-management consultation with the patient.
Hearing patient stories from the beginning, listening to the things that matter to them, and it being okay for patients to make decisions that feel right to them, which might be slightly different to the things that we feel matter. You need to have trust both ways round. Trust of clinicians of patients, and trust of patients of clinicians. Having been a consultant long enough to realise that the biomedical model on its own doesn't work, is to think about, shouldn't we be using the same evidence base that we use for clinical decisions for language and communication. A patient I saw in clinic who was alcohol dependent, tobacco dependent, already had emphysema in his lungs, was in and out of the emergency department. He has now been off alcohol for 6 months, is no longer gambling.
We've got to really look at it in the context of the current environment. There's lots of constraints on the NHS, and we've got to think of using our resources a lot more effectively. I think this is going to be something that we're all going to embed into our day-to-day practice.